Hi, everyone. Thanks for tuning in to COVID-19, the Humanities Respond. I'm Tyrus Miller, Dean of the School of Humanities, and I'm pleased to be joined by writer, author, and journalist, and professor in our literary journalism program, Erika Hayasaki. Hi, Erika.
Hi, how are you?
Very good, thank you. Thanks for joining us. At the time of this interview, Erika, you've written two long-form articles about people on the front line of the pandemic. One for Marie Claire, where you narrate the experience of a nurse in the COVID-19 ward of a New Jersey hospital, and also one for The Atlantic, where you follow a woman's unsuccessful quest to donate plasma to her husband who was dying from COVID-19. These are really incredible stories. How did you find them? How did you connect with these subjects?
Thank you for mentioning those stories. So I did both of those stories while social distancing. So usually as a journalist, your instinct is to go to the scene, and you want to spend time inside of the hospital alongside the nurse, shadowing them, or you want to go with the person who is getting the COVID test, or interview them in their home. And we can't really do that as easily now, obviously, for safety reasons. Even our students are not going out into the field to report because of the dangers of contracting the virus. So I still wanted to do some pieces out of this pandemic that I felt were important. And so I decided to try to do these while social distancing. So I found both of these women online, actually through Facebook. So, turning to your social networks, and I didn't know either of them. I should say that they were strangers to me. The nurse, Emily, had actually posted on a mom's group, ironically, in New Jersey, which happened to get shared somehow through my network, I think because I wrote a book about a nurse several years ago. And so it ended up in my feed, and it was a repost. And so I messaged Emily and I just said, this is what I would like to do. Could I shadow you virtually for a week and just find out what your daily life is like? And that involved, I asked her if I could check in with her daily. I even asked her if she would be willing to, take notes and journal through some of this experience, send photographs and other things like that. There was a staff photographer in the hospital who was capturing everything, and I was able to access those photographs as well and use them with the story. And I interviewed her really daily for a week, not knowing that she was going to end up contracting COVID as well. I mean, it was highly likely, but that happened over the course of my interviewing her. And with Chloe, it was the same kind of thing. Actually, there's all these different corners of the internet and Facebook where you find people on different chat groups, or, people sharing other people's messages. And I think hers came up because she was in Southern California and she was posting looking for a plasma donor for her husband. And so when I reached out to her, she was in that process of trying to find a plasma donor. She had also tested positive for COVID twice and was trying to get a negative test so that maybe she could donate to her husband who'd been on a ventilator for several weeks. I really hoped that would have a more positive outcome, her story. I thought maybe I would be able to see her donate at least, or, him get the donation. And unfortunately, he passed away right as I was beginning to write the piece. And I ended up just following Chloe a few more days through, unfortunately, his passing, and talking to her in the aftermath of that as well. So that was tough. But so both of those stories came about through social media connections. And again, I did not report them on the ground.
So that's really interesting, because in some ways, it's maybe part of the normal background of just we're using social media much more to find out things, to find people, to do research, to get leads. But it's taken on really exceptional importance in the situation where were literally cut off from, a number of the other ways of contact.
Yeah. And I have to say, I have colleagues and friends who are journalists who are going out and reporting in the fields now. They are out there just like war correspondents and risking themselves. And I know one just yesterday posted that he did test positive for the antibodies and he had been out reporting the whole time. But that's not, that's a personal decision and a decision on behalf of whatever the publication is that you're writing for. But for myself, at the moment, like, I don't necessarily want to expose myself, but I also feel like it's important, if you're a storyteller, to find some way to tell stories in this moment if you can. And so that was the way that I've approached it. And also, I think for our students, I wanted to show that they can also report these kinds of stories without exposing themselves to the dangers and the virus at the moment.
That's really important. Well, in terms of the way that you handled those stories, you talked about shadowing, and of course that's through these virtual means, but you also managed in the writing to really convey a kind of immediacy and a presence that is really a function of the literary technique and the writing that you do. Could you talk a little bit about, kind of how you took this raw material that you collected, but from afar, and brought us close up with that kind of immediate view?
Yeah, I mean, absolutely. So in our program and in the kind of journalism that I appreciate reading and writing, it's very much scene based, and details are everything. And without those details, it's just not the same kind of story. So that requires first access. So when you have somebody who's willing to give you access to send you journal notes, for example, or check in with you daily and let you interview them, or send you photographs, or let you be on FaceTime with them, which is what Chloe did, taking me along on the ride with her as she was getting tested and going through this. That's access, and that's like something you build with the people that you're writing about. But then once you have that access, you have to pay attention to the details in the scene, just like when you're on the ground. So in the nursing story, it became important. A moment that became important is when a woman who was on her deathbed, she had COVID, was describing, before she got very ill, the nurse was actually describing how her daughter could not go on this trip to it was like a Holocaust memorial trip. And she was disappointed because she was going to learn about the Holocaust. And the woman who was the patient explained, like, she knew a lot of Holocaust survivors, and she wrote down on a napkin the names of these people, and wanting to help this nurse's daughter learn more about it. And then the napkin, the nurse took the napkin home and intended to keep it. And in the end, the napkin got thrown away by accident. But it was just one of these details that sort of represented to me, the kind of helplessness in all of this.
Mm-hmm.
You don't have control. She meant to keep it. The woman ended up passing away. So you just have to pay attention to those little details along the way. And that's something we talk about all the time in our program. What are the details that matter, and maybe resonate thematically somehow within the piece, and then you pick those out and include them in your story. So it's a combination of observing, and sometimes observing through video and photos, or social media, but also asking the questions that elicit those kinds of details, and then delving into that a little bit more as well.
So you're also talking about maybe selecting an image or an event or a scene that, first of all, carries an emotional charge, but also is memorable for a reader. I mean, just hearing your recount that, I think lots of people will be thinking about that image of a napkin. And we all have some kind of memento that we've wanted to save and somehow we've misplaced or
Right.
left behind. And I'm really struck as a literary scholar, the way in which that resonates with the techniques that a novelist or poet, might select in terms of communicating in the fictional vein. You're using it to convey a real life story, but utilizing in some ways some of the same toolbox that that fiction writers are using. You're in a program called literary journalism, and we talk about that in terms of especially long form journalism, and a kind of longer narration of stories. I wonder if you could talk a little bit about what's special about having that longer form, and possibly the ability to apply a kind of more extensive narrative to a story, to unfold that for a reader.
Yeah, I mean, you're exactly right. So we are looking at the techniques of, or examining the techniques of fiction in our classes, and thinking about how these techniques become important in nonfiction too. So sometimes, you're not imagining the detail of the napkin. You're actually seeing the napkin and then thinking about and interviewing the subject about what the importance of the napkin is, right? But that still becomes a literary detail. And so, yeah, in our program, this is kind of what sets us apart from traditional journalism programs, which we do a lot of it too. And I think the traditional journalism is so important just to get to the level of understanding how to report an interview and do the reporting that finds the details in the napkin. But we focus so much on characters, real life characters who are going through things, whether it's in the moment or have gone through something in the past, and reconstructing that. So people that readers can connect to on some kind of human level. And so we look for those human themes in life and try to convey that on the page. We often try to write stories that are not just quick hit stories done in like a day, although you can do narrative in a day. I tell my students sometimes you can follow a person's day from the beginning to end, and there's a natural narrative arc in that progression. But you can do that over a week with the nurse, for example, and you can do that over a year. You can do that over 10 years, or you can go back and reconstruct over time. But chronology provides this kind of backbone to daily life, and you find that in your stories, and you can follow chronology. And that's why I think it's important for literary journalism. In this moment, there's so much journalism happening, and it's the news is moving so fast every day, and it's really hard to slow down. And so what I encourage our students to do, and writers, and what I'm trying to do in some of these pieces, is to just slow down for a little bit and follow a person for just a little more than a few hours, but over a course of a few days or weeks, and see what it's really like to go through something like this, and just find those moments. And I think that becomes memorable for Chloe, the woman who was trying to donate plasma to her husband. It was very unlikely that the plasma was necessarily going to work. He was in a really end stage moment. And so what her story showed so much of, though, was this sense of desperation, clinging to any kind of hope that she could.
Yeah.
And there was a moment where, after she tested for COVID, and she did not know yet if she was negative or positive, but she was, she drove to the hospital because she actually worked at the hospital but had not been allowed in, but they were going to let her come back to work because she wasn't having symptoms. And she got to the hospital to drop off her paperwork, and like snuck in to see her husband, and like stood outside the glass. And she told me she was going to do that before she did it, and then she actually did it. And then that very next morning, like around 1 a.m., he passed away. But it was such a powerful moment. And it's not the kind of moment you would see in a normal news story, I think, because it would get passed over in sort of all of the quotes and news of the story. But it was, I think, a moment that resonated.
Yeah, I mean, it's a really moving moment, and it's a moment of kind of, clearly of a kind of pain and a grievous nature, but also, that sense of almost the tragedy of desperately wanting to do something and just coming up against the limits of what one can do. It's a classic kind of almost tragic story.
Yeah, unfortunately. And again, I didn't want it to be a tragedy. I wanted something else, but that's the thing about writing about real life. And that's the moment that we're in. in so many ways in both of these stories shows like the helplessness or the despair. And there are many positive stories too, but this is the reality of what a lot of families are going through too. So you have to capture that.
I wonder if you could say a little bit about when you're advising your students or other people that you're talking to about following stories and effective storytelling in this moment of social distancing. Um, what are some tips that you have for that you're teaching your students, or that you would share with people? Might not even be professional advice. I think we're all kind of caught up in the need to communicate our experience from at a distance, or try to capture other people's experience from a distance. Are there ways in which you could advise us to navigate that distance more effectively to capture those experiences and those stories?
Yeah. So, I mean, the use of video has been quite handy for us. And I can't even tell you how many video interviews I've been doing that wouldn't naturally usually be video interviews. So, um, although it's not the same as being in person, it is a little better than doing it over the phone because you have that face to face and you have that scene that somebody's in. And so I recently have been asking subjects I interview, even for stories that aren't fully narrative pieces, can you take me inside of the world for a little bit with FaceTime, for example? So just yesterday, I'm working on a story that has it's a completely different kind of piece about robots and sort of the future of robots after the pandemic. And um, I made sure that I could get into. There's a grocery store in St. Louis that is already using robots, and have the workers kind of walk me around with the robots and show me how it is in the store. And you see then the people with the masks that are shopping and how they're kind of running up against the robot and looking at it strange, and all these little moments that happen. Um, so video is quite useful in that way, and um, we're sort of forced to do that now as journalists if you want to have these scenes and get inside. Um, like I said earlier, following time instead of just calling and doing the interview and then being done with it. Following somebody over a period of time, even if it's just a couple days, can be helpful. Um, Asking the subjects themselves to think about, to understand that what you're doing is a different kind of journalism. So it requires a level of detail that they might think doesn't make any sense. Like, why am I asking questions about what it looks like in the room, or what was going through your mind at that moment, or what you were wearing, or what somebody said to somebody else in that moment? I often have to explain to the subjects that, it's almost as if you have a documentary camera following you around. And
Mhm.
so that's the level of detail that I need, and almost training people for that kind of reporting to be journalists themselves. I mean, the nurse really turned into a journalist herself. She was journaling and writing notes and then sending them to me at night, which was huge on her part. And she, I think she actively felt it was so important to have the world, especially this was kind of in the beginning of the outbreak, to understand what it was like in hospitals at that moment. It was important for her, so she agreed to participate in this way. And sometimes they'll say they do that and then they don't, but she really did, sort of turn herself into a journalist. And she even said, I feel like I'm doing journalism. So, so she had to take these notes on the ground and describe, she would take photos and then sort of describe she used the Stranger Things. That was her description of the tubes coming out of the windows. And so, I mean, those are just a couple of techniques, but it's using a lot of what we've always taught in our program and just using it in different ways now, I think. And also a lot of us are looking at the current moment, and we're reporting it similar to how literary journalists have reported events of the past that they couldn't witness. So like Hiroshima, for example, by John Hersey, which is a book all of our students read, um, you know, that he was not there to witness the atomic bombing in Japan, but he went back and interviewed all these people and reconstructed it in such incredible detail based on that reporting for something he could never have witnessed, or he was not there at least for himself, right? And Seabiscuit is another example, or Hillenbrand. So, and Barry Siegel in our program does this. It's narrative reconstruction, but we're kind of doing it like live in the moment now.
That's a really interesting point. The kind of idea of a distancing in time and mediation through, you know, even archival sources that you're bringing into narrative, and the relationship to the social distancing.
Yes.
I also was really interested in what you were saying about the kind of almost co-creation or collaboration. I'm sure that in what we might call, you know, traditional journalism, there was always a strong element of it, but sometimes a bit hidden behind the story. And you know, this is an interesting instance where that's coming even more to the fore.
Yeah, and so I think, I mean, it doesn't work for every person, and not everybody wants to do that. As you know, everybody that's living this in the moment wants to go home and journal for a stranger. But you know, sometimes you can talk people into it because they also see the importance of stories, and then once you can explain why it's so important to have these details, because that's what helps make a story stick out and be memorable compared to like so many news stories we're just getting inundated with every day. It's really hard to keep up. And so for us, it's important to try to write these stories that just have just a few memorable moments that will stick with you, that are like these human moments. And
Yeah.
I think that's how it comes through.
Well, as a concluding question, I wanted to just kind of pull back the camera a little bit on a big level question. And it's you know, on the one hand, I think we've seen, partially because of economic pressures, partially maybe because of the political situation, but a certain decline and maybe hollowing out of a space of journalism that we've been able to count on, you know, for instance, newspapers that are closing down, those sorts of things. And also, obviously, a kind of political attack on journalism, discrediting even, you know, very high quality journalism. And I wonder if you have any thoughts that you wanted to share about the enduring value of quality journalism in a moment of national crisis like we're in.
Yeah, I mean, you know, I was at the LA Times. Um, I left the LA Times around 2009, and that was a moment where everybody was, you know, very worried about the future of journalism. Lots of magazines were shuttering, layoffs were happening all over the country, newspapers were closing down, and people said journalism is dead, you know, and that was 10 years ago. And I have seen a lot of struggle in the journalism industry, and it's changed and it's evolved, and but what I've continued to see though is incredible work on the part of these journalists and writers and colleagues and former colleagues and freelancers and students. So I, you know, because I've sort of had the benefit of seeing this over time, I know we're entering into another moment where people are very worried about the future of journalism, and we have been this whole time, but now it's, is COVID going to kill the last newspapers? Is, you know, but you see more publications pop up in different ways and thinking about different, more innovative ways to produce storytelling. Some places do not survive, and some places do. And but what I have seen is that I have not witnessed the death of great storytelling. In fact, over the last 10 years, long form journalism, narrative journalism, in-depth feature writing is wildly popular, you know, and that's thanks to the internet. And there are many, many places to publish now. That's not always easy for um, especially students coming out to make a living publishing this kind of work. But the passion is there, and the hunger is there, and there are places that want really quality storytelling and stories and real reported pieces. So I don't think that ever goes away. It's just a constant conversation about what does it look like, and how do you keep up with these changing times. So, but you know, I guess I'm an optimist about that.
Well, I want to be as well, and I think, you know, that's a heartening message. we'll be following your stories as you continue to, respond and bring to the fore different aspects of our current situation. And I want to really thank you for this wonderful conversation. And I'll just say to our audience, thank you for watching, and we'll see you in the next episode of COVID-19, The Humanities Respond. Thanks, Erika.
Thank you so much.
Bye-bye.